Dr. Deepak Garg. I'm an ophthalmologist practicing in Mumbai for the past 15 years. And today I'm going to talk to you about how would you as parents know if your children have glasses. It is not necessary that your child will complain that they cannot see clearly. And the reason why children don't complain is because they don't know any better. They feel that everybody around them is seeing the world exactly the way they are seeing the world. And there are certain clues that you as parents may get at home. The most important is, of course, when your child starts going closer to the television. If the child starts going closer to the television the minute you put it on, there is a probability that your child needs glasses. The second thing is if your child is squeezing their eyes to see clearly. Why the children do this is because if they have a number and if they're not wearing glasses, then when they squeeze their eyes, their vision actually becomes clear. If you start noticing that, then you know that the child may have glasses. Holding the iPad or the phone closer to the face than you would think normal is another indication that your child may have glasses. A few things that are kind of related to an eye number. One is when your child shows an urge to shy away from bright light, what we call as photophobia or light sensitivity. And there are 2-3 reasons why that can happen. The first is when your children have dryness, which could be because of excess screen time. The second could also be because your child has a squint. Now, a squint is something when your eyes are not aligned. So if one eye was deviated outwards or deviated inwards, then we have a squint. Usually, light sensitivity is seen in the squint where the eye is deviated outwards. It's also called exotropia. If you notice your child has a light sensitivity, then you may want to consider getting an eye examination because your child may have a exotropia. What a squint can also cause is the child to tilt the head to see things clearly. The other reason the child will tilt the head is because of a number that the child is not wearing. The kind of number that causes the child to tilt head to see clearly is known as astigmatism. It's not very common, but it can happen. So if your child is tilting his or her head to see things clearly, it's an indication for you to go get an eye exam. The other thing is where you see light sensitivity is in a condition called albinism. Albinism is a condition in which you have a very, very fair skin and you have very light colored eyes. And these children usually need glasses and they have significant light sensitivity. Another reason or clue that you as parents may see at home is your child complaining of headaches or your child complaining of eye strain. That could again be an indication that your child may actually need to wear glasses. I mentioned about squinting. Now, the medical term for squinting is strabismus. Strabismus is a condition that can be treated, so no need to panic, but at least your doctor should know what kind of strabismus it is. Some types of strabismus can be treated with glasses, and you can actually avoid a surgery if diagnosed correctly. Many a time we find that teachers actually tell the parents that your child is not copying correctly, or if I write anything on the blackboard, your child steps up from his seat and comes all the way in the front of the class to see the blackboard correctly. Now, when these things happen or when these complaints come to you from your child's teacher, there's a very high probability that your child will need glasses. So it's important to get an eye exam. You should also remember that if both the mother and the father have a minus number or have glasses, the probability of your child getting glasses is higher. And it doesn't mean that if parents don't have glasses, the child will not get glasses. Another thing to remember is if a child is born preterm, then there is a risk of developing a condition called retinopathy of prematurity. The short form is ROP. Now, ROP is a blinding disease, but if picked up in time by your ophthalmologist, then it can be treated and your child can have a normal life. You should also know that preterm children tend to get glasses much more than full-term children. We are living in COVID times. Everybody, including little children, which is very unfortunate but true, are on the screen. Now what using the screen does is it increases eye strain. There are certain tricks that you can do at home to help reduce that eye strain.